It's the battle of the bites. Snake bites versus spider bites. The first episode in Pros and Cons by a Piercer, episode number 61. So stick around. For those that are new to the channel, my name is DaVo. I'm a professional body piercer and have been since 1994. I own and operate the Axiom body piercing studio located here in Des Moines, Iowa, inside Skin Kitchen Tattoo. So when I talk to you about these things, I'm talking to you with a level of expertise as someone who has pierced professionally for well over 25 years. With that out of the way, what we're talking about today is 2 oral piercings, snake bites, and spider bites. This topic came from one of our viewers who asked if I could do some pros and cons based on bites. We're going to call it the Battle of the Bites, I guess. I don't know. So I'm going to be doing a series of these over the next few weeks, covering one versus the other one. The idea behind this is if you're one of those people that's thinking about getting either or of these piercings, it kind of gives you kind of a basis to maybe help you make that decision of whether or not this is going to spider bites or snake bites are going to be the best option for you. We're going to cover 5 major topics, and those are anatomy, placement, healing, jewelry choices, and the final one, living with the piercing, what it's like afterwards. So let's start out with anatomy. Anatomy on this, pretty much everyone can get this piercing done. I'm sure there's someone out there that has some issues, medical or health issues or what have you, that would impede them from doing it. The best candidates are those that have a lower gum line or a high gum line so that the back of the jewelry is not in contact with that kind of line where the gums start, especially if you're going with Labret piercings or Labret style jewelry. It varies from person to person, but most people's lower lip curves out greatly. The more that curvature is, the more it is probably a little bit better to do it with rings or what have you. This is something that you need to discuss with your piercer. That moves us on to placement. With placement, generally what we try to do is avoid that gum line. We try to be either above it or below it, or when we pierce with rings, more outside of the body or outside of the mouth. This is something you should discuss with your piercer going in. If you are planning on wearing rings, and that is a look that you're going for, I really suggest that you have it done at more of an angle through that tissue. The reason being is it's going to keep that jewelry out of your mouth. It's going to reduce the amount of contact that your teeth and gums are going to have with that jewelry. It's also going to make your life a little bit easier with eating and etc. However, if you pierce to that angle, wearing a Labret stud is probably going to be next to impossible or extremely uncomfortable. If you go with studs from the start, you need to understand that unless that piercing is perfectly placed to fit a ring perfectly around that, you're going to have to go with a large diameter ring that's going to have a lot of contact with teeth, a lot of contact with gums, and will cause issues. So discuss this. And I don't know how to tell you more than discuss this with your piercer. A lot of times they'll tell you it doesn't matter, you can wear a ring in it anyway, but let's face it, if the top of your lip to where that piercing is placed is a 1/2 inch, the smallest ring you can wear in there is a 1/2 inch, and that will cause issues. With snake bites, we generally will pierce even with the corners of your nose. The reason for this is that nobody's face is perfectly straight or perfectly evenly matched on both sides. So if we get out a ruler and try to measure from the corner of your mouth outward, it's not going to look straight. It's going to look like one is this way a little bit and one's this way a little bit. Our main goal is that they look like they're even from arm's length, which is the normal length that most people see you from, 2 to 3 feet. So keep that in mind. With spider bites, We generally will do them off to the side, usually about anywhere from a quarter to 3/8 of an inch inward, and then separate the two of them by roughly about a quarter of an inch to 5/16 of an inch, depending on what you want to go for. When we mark them, we'll generally make you make funny faces or move your lower lip a little bit, because we want to have an understanding of how much contact that is going to have with your teeth, especially if we're using Labret studs and we're piercing straight through. Very important that we know where that gum line is when we're marking it. Otherwise, it's going to cause damage or increase the risk of damage in the future. That moves us on to healing. Both of these heal about the same. They kind of have the same number of issues. You're going to see swelling with both of them. You're going to see a slight change in diet. You're going to have to be religious about how you take care of it. Neither of them are really more prone to problems other than the other, more so than the other one. They're about the same, but precautions do need to be made, and etc. The only real difference maybe is you maybe have a little bit more ease with eating if it's a spider bites opposed to snake bites, because it takes up more room in your mouth. So there's that. You pretty much are designated to the center, but even then you're going to have contact and etc. So that would be the main difference. The other thing would be sleeping. With spider bites, you might be able to sleep on the opposite side without issue. With snake bites, you're pretty much on your back. Though most people don't lay that far over, you might be okay with side sleeping. But keep in mind, it's on both sides, so it's going to have contact on both sides if you're a side sleeper. That moves us to jewelry choices. There's primarily two types of jewelry that you can use in both of these piercings, and that is Labret studs and rings. If the piercing is initially done with Labret studs, we tend to do it very, very straight, matching that at a 90-degree angle or 45-degree angle, I guess. With rings, we tend to get a little bit more outside the mouth, so it hugs the lip a little bit better. Really, with that style, you are definitely stuck with rings, and this is why you should discuss this, as I mentioned earlier, with your piercer. There's a great variety of both types of jewelry. Rings are going to be a little bit more inexpensive than, say, a Labret stud is going to be. The reason being is it costs more to manufacture them, they cost more to buy, and we pass that on to you. There is a large variety of both types, so various different ends, various different things that you can work with. As far as the look of it, if you're going for more of a bold look, more out there, the rings tend to draw more attention than the studs do. So that gets us to the final one, living with the piercing. This particular piercing, both of them have a high social prejudice to them. They are not a piercing that's really socially acceptable for most people. It can affect employment. It can affect how people interact with you. It is kind of an out there piercing, and it is something that you need to consider before getting the piercing. It can affect, if you want to work in the service industry for the rest of your life, it can even affect that. You really should be stable in your employment or your career before you get piercings like this. And hopefully, if you're lucky enough, you're in a career where you can wear these two piercings. As far as acceptability between the two of them, I don't really think there's much difference. I do think that people discover or notice the snake bites more readily than the spider bites. The spider bites, they tend to be a little less noticeable just basically because they're kind of off to one side opposed to both sides of your face. Of course, both of these piercings are going to affect eating even after they heal. I would say that the snake bites tend to affect eating more so, also kissing, etc., than, say, the spider bites. Just basically because they take up more room and they're on both sides of your face. As far as risk to enamel erosion, gum erosion, and softening of the bones inside your mouth, both of these have a fairly higher than just having one piercing level. I would say, though, is because you're centralizing that contact with the spider bites, it's probably less of a risk than having snake bites. basically because your structure in your mouth, when we're trying to get these even, with the structure in your mouth can sometimes be a little different inside. So you might be more prone to having problems just basically because the placement is slightly different in where it comes in contact with teeth and gums. That's not everybody, but it is something to consider. Sleeping, you're not going to be able to sleep on these piercings in some cases, even after they heal. Sleeping on them can cause trauma, which will cause even a healing piercing to flare up at times. So it may affect sleeping. So I think that's about all I have to say today on spider bites and snake bites, pros and cons. I hope you learned something today. Hopefully it helped you make that decision if you're on the fence between these two piercings. We'll be continuing this series next week with another one. Haven't decided which bites. If you have a preference, please make a comment. If you feel like I missed something or you have something to add to the discussion, maybe you've been living with these piercings for years and you've noticed this or that and I forgot to mention it or just blazed right over it, please leave a comment. We love it when you share your experiences. If you have any questions or you feel like I didn't cover something in depth, please leave a comment. Happy to answer those comments and questions when I have time. If you like the video, give me a thumbs up. Let me know that you like it, because I like it when you like it. It's fun. Makes me feel good. Especially if you learned something. Give me a thumbs up. If you're not subscribed already, hit the subscription and click on that notification bell so that you're notified every single time we post something. We average about 3 to 4 videos a week with a focus on education, on body piercing, and tattooing, and featuring some of the artwork of the artists here at Skin Kitchen Tattoo. If you like merch and you're a stylish individual with a lot of body art pride, check out our merch store. We have various different designs and products there for you to buy and purchase and wear and enjoy. If you look below this, there is a merch shelf where we have a few of the designs. To see all of them, you can click on the arrow and it'll take you right to our overall store. Also, there's a link in the description. Till next time, here's hoping all your piercings heal with ease and without a single issue. And if you're in the Des Moines, Iowa area, I hope to see you for your body piercing needs in the future. Stay safe, everybody. Stay well and wash your goddamn hands.